today we'll be continuing with the acid balance, in which we'll be learning the various disorders. Okay, and also we'll be solving some of the acid-base cases. Okay, so that is what we are going to do today. So yesterday we have seen in our basics. If I go to the next slide. Yeah, so we have completed what are acids, what are bases, and what are the buffers in our body. That is, what is the buffer in the plasma, buffer in the what you call the ICF, and also buffer in the urine. And also we have learned how the acid-base balance is maintained by three mechanisms. That is by buffers, first, by respiratory system, and by the kidney. So we have seen all these three systems which are acting as different level of defense. This is primary, secondary level, and tertiary level of defense to maintain a normal pH, which is ranging from 7.35 to 7.45. Okay, it is trying to maintain within that range. If it goes beyond or less than this range, then we come across the acid-base disorders. Yesterday we have seen like less than 7.35, we call it as acidosis. And if the pH goes more than 7.45, we call it as alkalosis. Or the acidosis means there is lot amount of H plus ions. Alkalosis means there is lot of base, OH minus ions, or base or the one who can accept the H plus ions. Okay, who can accept the acids and they reduce the acid content in the system. Okay, so this is what we have learned yesterday. Going ahead, seeing about the various acid-base disorders. Okay, acid-base disorders. We have seen if pH goes less than 7.35, we say it as acidosis. If the pH goes, say about more than 7.45, we call it as alkalosis. Means acid excess or base excess. If it is acidosis, then acid is more in the concentration. We have seen there are two types of acidosis. One is called as metabolic acidosis. Other is called as respiratory acidosis. Same way, the alkalosis is also of two types. One is metabolic alkalosis. Okay. And other is the respiratory alkalosis. So these are the basic four types of acid-base disorders, and which can be an important exam question for 3 marks. Okay, for 3 mark question, they'll ask you routinely what are the different acid-base disorders. Then these are the 4 disorders which are acid-base disorders. Okay, among them 2 are acidic conditions, and other 2 are basic conditions. The condition are the called as acidosis, and other is called as alkalosis. And we have seen also the ratio pH. In the equation, we see that the pH is dependent on 2 things: bicarbonate and carbonic acid, which is nothing but the metabolic component. Bicarbonate is metabolic component, and carbonic acid, that is carbon dioxide, is a respiratory component. Okay, so any change in the numerator will affect the metabolic component. Any change in the denominator will affect the respiratory component. Also, we have seen what is the ratio. Okay, the ratio of 20:1 means what? For every 1 acid, there are 20 bicarbonates. Okay, that is we call as a 3 mark question. Alkali reservoir. Okay, alkali reservoir means what? There is excessive amount of alkali or the base when compared to the acid. Why we want to maintain that is because normally body metabolism synthesizes lot of acids in relation with the bicarbonate or the base. So when you compare the base is synthesized in less amount when compared to the acids. That's why the body trying to maintain the ratio of 20:1 where bicarbonate is high and acids are low. So any change in this ratio will alter the pH also. Okay, will alter the pH also. Like if ratio becomes low, if ratio is low or decreases, pH also decreases, means it becomes acidic condition, acidosis. If ratio is high, like if it becomes 40 divided by 1, means it is increase in pH. The pH is increased. Increase means more than 7.45. So it is alkalosis. Anyone can tell. If acid is more in the body, then condition becomes acidosis. If base is high in the body, then it becomes alkali, so alkalosis. So ratio will define what is the pH, and pH will decide what is the condition of the patient. Either it is acidotic condition or alkalotic condition, acidosis or alkalosis. So today we will be seeing now the each one of the disorder. Okay. So first we'll see about the metabolic acidosis. Okay, metabolic acidosis. And whenever we are seeing about the conditions, 2 things we have to see in the body. What is it? First one, what is the primary defect? Okay, primary defect means what? Actually, who is causing this condition? Is it acidosis or alkalosis? There is different. But primarily, who is causing it? Okay. And second, when it is happening, what is the response by the body? Okay. What is the response? What is the response of the body to correct this change? What is the response of the body to correct this change? So any metabolic disorder or the acidosis or alkalosis, the acid-base disorders, we are going to see two things. First, what is the primary cause for it? What is the primary defect causing either acidic condition or basic condition? And second, we are going to see what is the response by the body. Is body showing any response or is it not showing? Okay, is it responding or not responding? These are the two things we are going to see. Okay. So first thing, when we want to tell metabolic acidosis, what should be the pH of the blood? Yes, it should be less than 7.35. Correct? So when it is less than 7.35, then only we call it as acidosis. Now I told you salt to acid ratio, that is 20:1. That is bicarbonate to carbon dioxide. Okay, is 20:1. Now if you want to tell metabolic acidosis, then the change should be in the numerator only. Now imagine if bicarbonate increases. If bicarbonate increases, okay, bicarbonate is increased. Is it acidosis or alkalosis? What is the condition?
Acidosis.
No. If bicarbonate is high, which is alkali, if bicarbonate increases, it is alkalosis. You are converting into alkaline condition. When bicarbonate is low, means there is no base only. When there is no base, then definitely it will turn into an acidic condition. Okay. So when we want to tell metabolic acidosis, it should be acidic condition. First thing, if you want to tell metabolic, then it should be the change in the bicarbonate, the primary defect. The primary defect is bicarbonate. That is, there is less amount of alkali. When there is low alkali, then definitely the acidic defect is decrease in bicarbonate levels. Now, what does the body will do? Always maintain. Body tries to maintain the normal 20:1. Like for example, the ratio I told you bicarbonate has reduced. So bicarbonate becomes 10 divided by 1. So 10 bicarbonates are lost. So ratio is reduced. Ratio is reduced. So pH is reduced. So it has become acidosis. The body will try to bring the ratio back to normal. What it will do? It will try to increase the, it will try to increase the respiration and wash out the carbon dioxide. Like for example, it becomes 0.5. If the carbon dioxide is low, if numerator is reduced, denominator also is to reduce. When there is lot of acid, I told you acids can be either volatile acid or it can be fixed acids. Concentration plus volatile acid is H2CO, which is nothing but carbon dioxide plus water molecule. So you can change the carbon dioxide. You can change the concentration of carbon dioxide comfortably by only either increasing the respiratory rate or decreasing the respiratory rate. So if you want to bring the ratio back to normal, you increase the respiration. So what is the compensation or response to the body is body tries to decrease. Yes, body tries to decrease the concentration of the acids also. It tries to decrease the acid, that is decrease in carbon dioxide. How it can reduce the carbon dioxide in the blood? Simple. It can reduce the carbon dioxide in the blood by increasing respiratory rate. You increase or hyperventilate, carbon dioxide decreases, ratio decreases. If acid becomes less, so finally what has become the ratio? 20:1. Again, pH comes into the normal range. Okay, whenever you are seeing a defects, metabolic or respiratory defect, you should always see first what is the primary defect. Acidosis. First you see the bicarbonate levels. Acidosis means bicarbonate should be low. Because when bicarbonate is low, then only we call it as metabolic. Okay, so metabolic acidosis. If it is a metabolic acidosis, the primary defect is decrease in concentration of bicarbonate. Next, second, you have to see what is the compensation. What is the compensation? Compensation is the always it goes in hand. For example, if numerator decreases, then compensation is denominator also decreases. Like this example, I told you, if bicarbonate is low, what does the body response is? It will also decrease if numerator is low, it will decrease the denominator also, so that the ratio can be brought back to normal. The ratio is brought back to the normal of 20:1. Okay, so that is about the metabolic acidosis. Now, metabolic acidosis, I told it can be of two types. Metabolic acidosis can be of two types. One is high anion gap. Okay, high anion gap metabolic acidosis, and other is called as normal anion gap metabolic acidosis. Okay, high anion gap and low anion gap. Yesterday I told you how you are going to calculate the anion gap. It is nothing but sodium plus potassium difference with the chloride and bicarbonate. Right. So you are having the positive ions and negative. It is 8 to 16. Okay, 8 to 16 is the difference. If it goes beyond 16, like say about the anion gap has come 24, then it is a high anion gap metabolic acidosis. Why there is high anion gap is, I told there is something else. Some acids are increased in body, like keto acids are increased in the body. Take a case of diabetic ketoacidosis. Ketone bodies are high in the blood. When ketone bodies are high in the blood, they will contribute to the charge. So that time the difference is lot. Difference goes beyond the 16, where it becomes a high anion gap. Sometimes acidosis is there, but the value is say about 12. Okay, anion gap is only 12. So there is primary defect. There is no other acids are increased. Okay, so you have got two types. One is called as high anion gap metabolic acidosis, and other is called as normal anion gap metabolic acidosis. Hagma and Nagma. Okay, high anion gap, if it is going more than 16 milliequivalents per liter, that is called as high anion gap. Who are the things who will increase the high anion gap is most commonly lactic acids or keto acids or ketone bodies. They will increase the anion gap. What are the conditions in which they are increased? The conditions includes the diabetes mellitus, like DKA, okay, or even starvation, because in starvation what we see a lot of ketone body synthesis, okay, and also in the high breakdown, like you see in the case of high fevers. Okay, so under these all conditions you will see, and also like for example renal failure. Okay, renal failure. So these are the conditions in which you will see metabolic acidosis. Along with it, what happens to anion gap is it is increased. There is increase in the anion gap in the system. Other thing is normal anion gap, NAGMA. Okay, normal anion gap is 8 to 16 milliequivalents per liter. Okay, milliequivalents per liter. Normally what happens is there is lot of loss of both the things. Okay, you imagine there is some amount of sodium is lost and also bicarbonate is lost. Sodium is also lost and bicarbonate is also lost in say about equal concentration. Then what happens to difference? Difference remains same. Like for example, you imagine 140, okay, minus 130 is also 10. Okay, or 130 minus 120 is also 10. There is no change in the difference because there is loss of ions from both the side. Plus ions also lost and minus ions also lost. Like in the case of diarrhea, okay, like in the case of diarrhea, you are losing the bicarbonate also, and also you are losing the hydrogen ions also. Okay, and you are losing some amount of sodium also. So there is equal or relatively both are lost. The cations are also lost and anions are also lost. Hence, there is no much difference in the anions and cations, and anion gap remains same or similar, and it will fall within the normal range. That is called as normal anion gap metabolic acidosis. Why we call acidosis is because acids are high. The H plus ion is in the high concentration, but the anion gap is in the normal range. So that is called as normal anion gap metabolic acidosis, and other one is high anion gap metabolic acidosis. Okay, and I told you what is the compensation. Compensation is increase in the ventilation. Okay, previously we have seen. What is the response? The response is increase in respiration, which will wash out the carbon dioxide so that the acid level also starts dropping. When acid decreases, definitively the acidosis also will go towards the normal range. Okay, so that is about the metabolic acidosis. Okay, next, second is respiratory acidosis. Again, if I tell you acidosis means what happens to pH? pH is less than 7.35. When pH is less than 7.35, then only we call it as acidosis. And second, I told you what is the ratio? 20:1, which is given by carbonic acid divided by carbon dioxide. Also, I told you, if you are telling respiratory acidosis, then which parameter is defected? The carbon dioxide. Numerator is always for metabolic component, denominator is always for the respiratory component. Now, respiratory acidosis means there is increase in carbonic acid levels. When you increase the acid level in the blood, what happens to the blood pH? Blood pH will go towards acidosis. Okay. So the primary defect in the respiratory acidosis is increase in carbon dioxide, which is nothing but increase in carbonic acid. So when acids are increased because of stagnation of the carbon dioxide, when the carbon dioxide will get retained in your body, yes, when there is decrease in respiratory rate
Hypoventilation.
or respiration. Okay, when there is decrease in respiration, definitively carbon dioxide concentration starts increasing because you are not expiring it out. When you are not expiring it out, carbon dioxide concentration starts increasing in the blood. When carbon dioxide increases, definitively carbonic acid level also increases. So what happens to ratio? It was 20/1. Now it is becoming 20 divided by 2. Now what is happening to the ratio? Ratio is reducing because 20/2 is 10/1. Now, this is the primary defect. The primary defect is the person is having stagnation or accumulation of the carbon dioxide, which is nothing but carbonic acid excess, and it is leading to acidosis. Now, what is the body compensation? Yes, what does body should do? I told you, whenever denominator increases, which direction the numerator goes? It also increases. Okay, the compensation is always in line with the primary defect. Please remember, compensation is always in line with primary, okay, primary defect. I told you, like for example, if there is increase in bicarbonate, then what happens as a compensation is increase in carbon dioxide. If there was increase in carbon dioxide, like in our case, okay, respiratory acidosis, this is the primary defect. Primary defect is excess of carbon dioxide, excess of carbonic acid. The compensation is the body tries to increase the bicarbonate also. The compensation is increase in bicarbonate levels. So if this was 20/2, now it becomes 40/2, which is again comes to 20/1. So body is trying to compensate the primary defect. The primary defect was increase in carbon dioxide. The compensation is body tried to increase the other component, that is the bicarbonate, bringing back the pH or ratio to normal, and hence it will be brought back. The pH is brought back to normal level of 7.35 to 7.45. Okay, this is about the respiratory acidosis. Respiratory acidosis means there is acidosis. When we call it respiratory is when the primary defect is due to change in carbon dioxide levels. If the primary cause is due to carbon dioxide change, then we call it as respiratory acidosis. So that is about the respiratory acidosis. What are the conditions? Conditions can be one, any respiratory distress syndrome. Okay, when respiration is not properly occurring, carbon dioxide retains. It can be even in pulmonary edema. Okay, pulmonary edema. You can have the respiratory acidosis, or you can have in the pneumothorax. Okay, or these all can be acute condition. There can be chronic condition like you can have the emphysema. Okay, emphysema, it can be emphysema or paralysis of the respiratory muscles. Okay, paralysis of the respiratory muscles or any head trauma. So these all can be a chronic cause where carbon dioxide is retained. There is increase in carbon dioxide, which is the primary defect. The primary defect of whole this process of respiratory acidosis. Okay. So what is the compensation is? Body tries to increase the bicarbonate levels, and also kidney will try to excrete lot of hydrogen ions in the urine. Okay. So that is the respiratory acidosis. The third component that is now we'll yes.
Sir, in the chronic condition, why is the carbon dioxide is increasing? The kidney is regulating it in long-term regulation, but still why?
Correct, but still the lungs are but still it is slow rise in acidosis. There is no sudden rise of acidosis, but definitely body is failing because when some organ is failed, it is not functioning properly, definitely the body will try to adapt for the new change. So the body will go into a long-term chronic respiratory acidosis because the respiration is not proper. Carbon dioxide, instead of, like, for example, normal level carbon dioxide is 35 to 45 mmHg. Because he is having a chronic disorder, his CO2 is always maintained at say about 49 or 48 mmHg. So he's having always retaining of carbon dioxide. Definitely the kidneys are functioning, but still he'll be having a chronic acidosis, which is mild, which will not cause any much derangement until he'll have acute episode over the chronic. Like, for example, he is already emphysema patient. Definitely the severe respiratory already at the suboptimal level. Now he is having the acute of infection, which is also hampering respiratory in the carbon dioxide. So that's why chronic causes also will be there. Chronic causes also will be there for that. Okay. Okay. Next is metabolic alkalosis. When we are talking of alkalosis, again, alkalosis are of two types: metabolic and respiratory. When we call it as alkalosis, the pH should go more than 7.45. Yes. So when pH is more than 7.45, the condition is called as alkalosis. If we want to tell it metabolic, which component should be altered? HCO3 or CO2? Yes. Which? Correct. Bicarbonate. Now, bicarbonate should increase or decrease to become alkalosis?
Increase.
Increase, because it's alkaline. When you increase the alkali, definitely the blood becomes alkaline in nature. So what is the primary defect now? Primary defect is increasing bicarbonate levels. Okay, increasing bicarbonate levels is the primary defect in the metabolic alkalosis. Now, what should be the compensation? Yes. What happens to the carbon dioxide? Will it increase or decrease? Increase. Yes. I told you, compensation always go in hand with the primary defect. If primary defect is bicarbonate is increased, then the body tries to increase the carbon dioxide also. That's the compensation. How it can increase the carbon dioxide levels? By decreasing the respiratory rate, by hypoventilation. By hypoventilation, it can decrease the respiration and increase the carbon dioxide. So that, for example, if this was 40 divided by 1, the body tried to increase the carbon dioxide concentration to make it 40 divided by 2, and which brings back the normal ratio of 20:1. So compensation is body tried to make it acidic, respiratory acidic. Okay, increase in carbon dioxide. So this is how metabolic alkalosis. Okay, what can be causes? Cause of metabolic alkalosis? Like, for example, if there is excessive loss of H plus ions in the GI tract. Okay, like excessive vomiting. We all know the HCl is secreted in the stomach. If you are vomiting excessively, then definitely you are losing the H plus Cl minus in your vomit. That is, acid is lost, and this is not controlled, uncontrolled. So definitely the acids are lost. So relatively the bicarbonate concentration increases in the body. So that is one. Second is excessive aldosterone. That is called as hyperaldosteronism. Okay, hyperaldosteronism. Because what happens is, in hyperaldosteronism, there is excessive potassium loss. Excessive potassium loss. Because of this, what happens is, now these are the cells, normal body cells. The potassium is lost out of the cell in exchange for H plus ions. So acid which was present in the blood is moving into the cells. So what is happening? The H plus concentration in the blood decreases, means it becomes more of alkaline. Okay, when acid is less, then it is relatively more of basic in nature. Okay, so hyperaldosteronism also, you can see the metabolic alkalosis, or sometimes in severe dehydration. Okay, in severe dehydration, because excessive amount of water is lost, hydrogen is lost, and relatively the bicarbonate concentration increases in the blood because of dehydration. And also you can have in the case of antacids. Okay, heavy ingestion or administration of antacids. Okay, antacids which people take for acidity. If they take lot of antacids, then again, what happens? Lot of acid is removed from the system. There is no reabsorption of the H plus and chloride ions in the GI tract, because of which acids are lost continuously, which will collectively causes decrease in concentration of H plus ions, and person will end up into metabolic alkalosis. Okay, so that is about the alkalosis. The fourth one, last one is respiratory alkalosis. Now again, if I tell you alkalosis, what should be the pH? pH should be more than 7.45.
7.4.
Yes, if we want to tell it is respiratory, which component should alter? Is it numerator or denominator?
Denominator.
Denominator. What happens if carbon dioxide concentration increases? Is it acidosis or alkalosis? Carbon dioxide concentration increases in blood. Is it acidic condition or basic condition?
Acidic.
Yes.
So carbon dioxide increase in acidosis.
Yes. So when we are telling it is respiratory alkalosis, so what should be carbon dioxide is? It should decrease. If you want to tell respiratory alkalosis, the carbon dioxide levels are less. So what is happening is acid levels are less. So the person, what is the primary defect? Primary defect is decrease in carbon dioxide. What can be caused? Like for example, if person is hyperventilation, okay, under hyperventilation, there is a lot of carbon dioxide lost through the lungs. So when the carbon dioxide is lost, carbonic acid is lost. So the person end up into respiratory alkalosis. Now what should be the compensation? What happens to the bicarbonate levels? Bicarbonate levels also will start reducing. Correct? Because yes, they always, the compensation goes in hand with the primary defect. If carbon dioxide decreased, bicarbonate also decreases. If carbon dioxide is increased, bicarbonate also increases. And same way, vice versa. If bicarbonate is high, carbon dioxide also goes high as a compensation. And if bicarbonate is low, carbon dioxide also comes to low. So compensation is decrease in bicarbonate levels. So that is seen in the case of respiratory alkalosis. Okay, respiratory alkalosis, it can be because of hyperventilation. Okay, what can cause the hyperventilation? Like for example, you going to a high altitude area. Okay, high altitude area. What happens? Because of less oxygen atmospheric pressure, the person will start increasing the respiratory rate, which you have already learned in the physiology of oxygen dissociation curve. So during that process, what happens? Because of hyperventilation, you are actually exhausting all the carbon dioxide reservoir, because of which the person will end up into the respiratory alkalosis. So oxygen deficiency in high altitude is one of the cause for respiratory alkalosis. Sometimes you can have fever. Okay, fever also will increase the respiratory rate. It will increase the cardiac rate also, that is heart rate. Okay, your tachycardia and tachypnea, you will be having more amount of respiratory rate and also high amount of the heart rate also. So in the fever, or same holds good with the anemia. Okay, if the person is anemia, because the body is not supplied properly with the oxygen, definitely it has to work more for circulating the oxygen to the tissues. So during these conditions, you might see respiratory alkalosis because there is lot of respiratory rate, hyperventilation, decreased carbon dioxide. Decreased carbon dioxide will alter the ratio of 20:1, which will cause the respiratory alkalosis. Okay, respiratory alkalosis. What the compensation is? The body tries to decrease the bicarbonate. Parallelly, it will kidney. Okay, the kidney will try to retain the H plus ions because you are it's already alkalosis. You want to retain some amount of acids. So you are retaining the acid and excreting the bicarbonate. Okay, or excreting the bicarbonate. So this is how you are going to do the compensation for respiratory alkalosis. So at the end of all the 4 metabolic disorders, we understood acid-base balance. Okay, acid-base balance in which body always try to maintain pH of 7.35 to 7.45. Anything less than 7.35, it triggers to acidosis. Okay, anything more than 7.45, it triggers to alkalosis. And body tries to maintain a ratio of salt to acid 20:1. Okay, that is bicarbonate to an acid. Okay, bicarbonate to the acid is always maintained at 20:1. First thing, if there is acidosis or alkalosis, there is always primary cause. Primary cause is the one which is causing this disorder. To bring the disorder back to normal state, the body always tries to compensate. Okay, the body always try to compensate or compensation. Now, this compensation can be of 2 things. Either it is successful to compensate. Okay, it is successful to compensate. That is complete. Okay, the compensation is complete. When we call it complete, like for example, there was acidosis. Initially, the pH of 7.29 of a patient, primary defect, the body has compensated and brought the pH back to 7.35. Now, this is called as complete compensation. Initially, it was 7.29. Now, it has come to normal level. It is called as complete compensation. if compensation is partial. When we call compensation is partial, same example, like it was 7.29 initially when the patient is having the acidosis. The pH has come only 7.32. Now, if you see, this is still in the acidosis only. Compensation is there, but still it is in the acidosis. The compensation is termed as partial compensation. Okay. Either you can have complete compensation or partial compensation, or there is no compensation only. Ideally, I told you, if there is decrease in numerator, the carbon dioxide also should reduce. But here, we are not seeing any change in the carbon dioxide. The carbon dioxide is in the normal range only. In spite, there is primary defect. So we will tell that as non-compensated or no compensation as Berlin. Okay, like 7.29 is the pH. After 6 hours or 10 hours or 12 hours, still the pH is 7.29. Means there is no compensation started. The body has not started to compensate to bring the pH back to normal. So these are the few things you should understand in acid-base balance. What is the normal pH? Then when we call acidosis and when we call alkalosis, then how the body will adapt to the primary change and how the body will try to compensate. So this is about the acid-base balance. Okay. Next, when we are discussing acid-base balance, we should know 3 important parameters and the normal values: pH, bicarbonate, and carbon dioxide. Because if you see any blood acid or acid-base balance or arterial blood gas analysis reports, these 3 parameters are very important. What are they? pH. What is the normal level of pH? 7.35 to 7.45 is the normal pH. What is the bicarbonate level? We take it 22 to 26 milliequivalents into the normal range. If it goes less than 22, it is decreasing bicarbonate levels. If it goes more than 26, it is increase in the bicarbonate levels. That's what the interpretation is. Okay. Next, third, carbon dioxide. What is the normal level of carbon dioxide? Is 35 to 45 mmHg. Okay. If it goes less than 35, then it is decrease in carbon dioxide levels. If it goes more than 45, then it is increase in carbon dioxide levels. Is this much clear?
Yes, sir.
Yes, great. Now, next comes is we'll go to the yesterday you have shared some slides, so we'll go to that slides, then we'll come back here. So you have shared this slide where a patient of 75-year-old with history of very severe COPD presents in emergency department. Okay, all that is there. Now if we see the things, the pH is 7.15. Okay, next, bicarbonate is 32. Carbon dioxide is 68. Now when this kind of report is given to you, okay, always remember you should follow one pattern. Okay, what is that pattern? I'll tell you. Whenever you are going to see any blood gas analysis report, which one to see first is very important. Which one to see first, which one to see second, and which one to see third. Okay, always first thing you have to see in any blood gas analysis is pH. Why it is important? Because you should identify whether the condition is acidosis or is it a alkalosis. Okay. But you have to define what is the condition. Is it acidosis or alkalosis? Always first you see pH. Second, you should see always is bicarbonate levels. You have to always see bicarbonate levels, whether it is normal, decreased, or increased. Whether it is normal, decreased, or increased than the normal range, 22 to 26 milliequivalents per liter. Now, third, you see what is happening to the carbon dioxide levels. Is it in the normal range, decreased, or increased? Why? I'll tell you next. Okay. But now, please imprint in your mind, you should see in this sequence pH first, bicarbonate second, and CO2 third. Is it clear?
Yes, sir.
Yes.
Yes.
Yes. Yes. So we'll see some scenarios first. Okay. We have pH, we have bicarbonate, and we have CO2. Okay. Now imagine pH has gone to 7.25. Now, is it acidosis or alkalosis?
Acidosis.
It's acidosis. Correct. Now imagine bicarbonate is what I told you should always see second is bicarbonate. Say bicarbonate is 32. Bicarbonate is 32. Do you think bicarbonate is causing acidosis? Yes or no?
No, sir.
No. Because if bicarbonate is high, it should be actually alkalosis. But here it is acidosis. So bicarbonate is not the main reason. Now you see third, carbon dioxide. You see the carbon dioxide is 50. Is it normal or high? Definitely it is high.
High.
Interpretation is high. So now you see, is it going in hand? Carbon dioxide is high and it is acidosis. So what is this cause? What is the disorder? I will tell it respiratory acidosis. Acidosis. Yes. Now you see the second component again, because I told you always we should see primary defect and then we should see what is the compensation. Now carbon dioxide is increased. If we want to tell it is compensation, what should happen to the bicarbonate? It should be high. Do you think it is high? More than 26?
Yes. Yes.
So it is, yes, it is compensated. But do we think it is partial or complete? The pH is still out of the normal range. So it's a partial compensation. Okay, it's a partial compensation, respiratory acidosis. Now, second scenario you can see, like say about 7.49 is the pH. Now, what is this? Acidosis or alkalosis?
Alkalosis.
Yes, it's a case of alkalosis. Now, second we should always see is the bicarbonate level. You imagine the bicarbonate level is say about 32, same. Okay. Now, do you think it is going in hand with the alkalosis condition?
Yes.
Yes. Bicarbonate is high. There is alkalosis. Then definitively it's a metabolic alkalosis. Why we call metabolic? Because the component is metabolic, bicarbonate. Now, third you see the carbon dioxide. What is the level of carbon dioxide? Now, carbon dioxide is within the, is it normal or low or high? Normal is 35 to 45. So it's in the normal range. Yes. So primary defect is metabolic alkalosis. What is the compensation? No compensation because there is no change in the carbon dioxide concentration. It is still in the normal range. So that's why there is no compensation. But what is the primary defect is metabolic alkalosis. Okay. Next, you imagine what scenario we can give? 7.20. Now, what is this condition? Alkalosis, acidosis.
Acidosis.
Yes, because pH is less than 7.35, so it is acidosis. Okay. Now you imagine bicarbonate level is 12. Now is it normal or decreased? Decreased. Decrease in bicarbonate means base is less, so relatively acids are high. So what kind of disorder it is? Metabolic acidosis, because the primary defect is decrease in bicarbonate levels. Now you see third component. What is happening to the carbon dioxide? The carbon dioxide is 30. Now, if you see carbon dioxide 35 to 45 normal range, this is also decreased. Now, you see, is it complete or partial compensation? Partial. Why we call partial? Because still pH is out of the normal range. Okay, like for example, this is a day 1 of the patient. Now, day 5 or day 3 you take. Okay, you have went to day 3. Now, pH is 7.36. Still, these defects are there, 13 and 31. Now you see this, it is say metabolic acidosis, but complete compensation. There is complete compensation because pH has come back to normal. This is same patient. Okay, same patient. Initially, it was metabolic acidosis with partial compensation. After 3 days, the compensation has successfully brought the pH back to normal of 7.35 to 7.45. Okay, this is how the body will try to compensate and bring the pH to normal. After some days, these also will come into normal range. Okay, after some days, the bicarbonate levels will come in the normal range of 23. Okay, carbon dioxide will come into the normal range of 41. So after a few days, it will also come back to normal. But here, thing is, whether the pH has come back to normal or not is a thing. Okay, so metabolic acidosis has complete compensation. Okay, it's completely compensated. Is it clear how to interpret?
Yes, sir. Yes,
Yes.
sir.
Yes. So we'll see these slides which you have shared, Akansha. So if you see this first one, pH is, first we should see always is pH. So pH is 7.15. What is the condition? Alkalosis or
Acidosis.
okay. So when you see 7.35, so definitely less than 7.35. Then bicarbonate is 32. Bicarbonate. So do you think it is going in hand with the acidosis?
No,
No.
sir.
Not going. So it is not the primary cause for acidosis. Now you see the third component, partial pressure of 68. Is it normal? It is high. Increase in carbon dioxide, increase in carbon acidosis. The primary defect is acidosis. This case is primary defect is respiratory acidosis. Respiratory acidosis. Next, we want to comment on compensation. Whether the compensation start. Yes, when carbon dioxide is bicarbonate is also increasing. Okay, present there is compensation. Is it partial or complete? Okay, is it partial or complete? It is partial. Why? Because the pH is normal range. It has not come back to normal. Okay, so it's a sometimes what we call respiratory acidosis with metabolic alkalosis, which is partial compensation. Will you agree? Primary defect is respiratory acidosis. Secondly, if bicarbonate increases, the response of the body is it is trying to make it alkalosis. How? By increasing the bicarbonate levels. Bicarbonate level, I told you, it is always metabolic component. So we call it respiratory acidosis with compensation as metabolic alkalosis, which is partially compensated because pH is still out range. So this is about the first case. Now, second case, if you see blood pH, 7.55 is the pH. Is it high or low? Is it acidosis or alkalosis?
Alkalosis.
Yes, alkalosis. Now I told you have to see second component is bicarbonate. Okay, what is the bicarbonate levels? It's 30. Now, do you think increase in bicarbonate will cause alkalosis?
Yes.
Yes.
No.
Yes or no?
Bicarbonate. Yes. Yes. Yes.
Yes.
Bicarbonate.
Yes. So what is the primary defect now? Primary defect is metabolic because bicarbonate is increased. Metabolic alkalosis is the primary cause. Now you see the third component, carbon dioxide, partial pressure of carbon dioxide. What is the levels of carbon dioxide? It is 50. Now, do you think 50 is increase or decrease?
Increase.
Normal. Yes, it is increased. So if we want to tell compensation, what should be the direction of the movement of parameter? Same direction. When bicarbonate is increased, carbon dioxide is also increasing. So whether compensation has started? Compensation is there? Yes, compensation is there. Is it partial or complete? It is partial. Because still the pH is out of the normal range where it is still in the alkalosis. So this is case of metabolic alkalosis. Okay, with respiratory acidosis as compensation. If you see here, what is the compensation? Increase in carbon dioxide. Increase in carbon dioxide means what? It is causing acidosis, which is respiratory cause. So secondary, that is compensation is increase in carbon dioxide, which is present, compensation is present, and it is partial. It is not completed. Okay, so that is about this case. Last one, the pH here in the case is 7.56. Now, is it high or low? Acidosis or alkalosis?
Alkalosis.
Yes, good. It is alkalosis. Now, in the alkalosis, second we have to see is bicarbonate levels. So it is around 37. Now, is it high or low? It is high.
High.
So bicarbonate high, alkalosis, they go both in hand. So primary defect is metabolic alkalosis. Now we want to see carbon dioxide levels to tell whether compensation is there or not. So carbon dioxide level is around 40. Okay, 40 mmHg. Now, do you think it is a normal or abnormal range?
Normal range.
Normal range. So now you tell whether there is compensation.
No compensation.
No compensation. Still the patient is in the initial phase only, where he has just developed the alkalosis, which is metabolic alkalosis. So this is the case of metabolic alkalosis with no compensation initiated. Okay, there is no compensation initiated in this case of patient. Okay, so these are the cases you shared with me. 4 are there, I think. So this is 1, 2, 3, and 4. Okay. So with this, we'll be winding off for the acid-base balance. Most commonly, they'll ask you in the exam about today's topics. Metabolic acidosis, you have to define what is metabolic acidosis, then how you are going to tell it is what is the primary defect and what is the compensation. Then also what are the causes, what are the 2 different types of metabolic acidosis, that is high anion gap and normal anion gap metabolic acidosis. Then sometimes they'll ask you for 3-mark question. Write the causes for respiratory acidosis. Write in detail about the metabolic alkalosis. What is the normal blood pH? Okay, 7.45. Or sometimes they'll ask you, right, how you are going to approach a acid-base analysis report. So the one which we have seen by putting up table and column. Okay, so if there is pH less than 7.35, what it is called as, more than 7.45, what it is called as, and how you are going to interpret as primary disorder, and how you are going to see compensation. Okay, and what are the basic parameters required for acid-base disorder identification? pH, then bicarbonate, and carbon dioxide. Apart from these three, to tell whether it is normal anion gap or no, for anion gap calculation, you need to always have sodium levels, potassium levels, and chloride levels also. Because we know the equation, sodium plus potassium, difference with the chloride plus bicarbonate will give us the anion gap. So to calculate anion gap, apart from ABG, which contains pH, bicarbonate, and carbon dioxide, it also contains this electrolyte panel also. That is sodium, potassium, and chloride to detect if there is metabolic acidosis. Is it high anion gap or a normal anion gap metabolic acidosis? So this is about the acid-base balance and acid-base disorders approach, how you are going to identify the disorders. Okay, so with this, we'll be ending the session of acid-base balance. Okay, is there any doubts which we have to clarify?